Hello everyone, this is Akash Kolapalli. My student ID is BP03187002 and today I am presenting my project proposal on cybersecurity threats in healthcare industry, specifically focusing on ransomware attacks. This slide introduces the topic of ransomware in healthcare. The first point I mentioned was the recent trend in the healthcare sector of UK has navigated towards the magnificent issue related to the cybersecurity in the use of digital tools in healthcare. The second point I mentioned was this presentation will reflect upon the real world business problems along with the dependencies on the digital system as exposed the healthcare organization related to the cybersecurity threats in healthcare organization. The overview of this slide is increasing in the focus of digital health market of UK. It is projected to reach 18.7 billion by the end of 2030. The most pressing issue is related to strong data security and safeguard patients' privacy, where healthcare data goes digital and it is becoming target to the cyber criminals. With the increase of use of connected devices and electronic health records, the rate of cybersecurity systems. This slide titled as Overview of the case. First point. The UK healthcare digitalization has been further driven by innovation in telehealth and mobile health application. Second point. Due to such digital technology, it has created vulnerabilities for cyber threats where the patient's sensitive data is exposed. The overview of this slide is the healthcare organization is responsible for handling confidential patients' data information, making it attractive for cyber criminals. The NHS of the UK have also used digital technologies and faced many issues, especially on ransomware attacks. This slide titled as Problem Definition. First point, ransomware attacks have ultimately restricted data access and encrypted information unless some payments are made. Second point, without the strategic technology management, hospitals are vulnerable to evolving the ransomware threats. The overview of this slide is with an increase in the rate of attacks, it causes patient delay, data loss, and downtime, which are the major problems that are faced by the healthcare organization. One of the case example is Synovis, which is one of the incident in London which have altered vital pathology services in NHS. This slide titled as Ransomware Attack. First point, ransomware attacks have focused on encrypting the critical data, locking the hospital system until the payment is made. Second point, all through hacking or its incidence has become the leading cause of these increases. The ransomware attacks causes a delay in the emergency case. The overview of this slide is ransomware attacks have focused on hospitals to delete treatments and cancel tests, which have become the dangers for patients' lives. Patient strategy and advanced technology have further limited the service destruction and recovery cost. This slide titled as Proposed Solution. First point, a cloud integrated AI driven cybersecurity framework which effectively combines zero trust security, artificial intelligence, and blockchain is proposed. Second point, it has effectively provided continuous threat detection and secure data backups for improving the healthcare system against ransomware. The overview of this slide is AI has effectively detected the issues on the real time basis while ensuring the data restoration and blockchain improves the traceability in the healthcare sector. With this framework, it would focus towards integration and the detection and prevention while minimizing the financial and operational impact. This slide, titled as Continuation of Proposed Solution. First point, the zero trust architecture that has been utilized in this proposed solution focuses on ensuring and restricting access and privacy protection. Second point, this proposed solution is focused on addressing multi-factor authentication, and staff cybersecurity training, which reduces vulnerability and human errors. The overview of this slide is the effective implementation of training and awareness programs focusing on empowering the staff to identify and avoid phishing attempts. Hospitals, which use similar models, are focused towards achieving an increasing reduction in the phishing attacks while demonstrating the practical effectiveness of the solution. This slide, titled as Project Plan, this slide mainly focusing on outlines of the timeline and detailed steps for implementing the proposed AI-driven cybersecurity solution. This page contains two main elements, a Gantt chart and a project table. Gantt chart. With this phased rollout, there is focusing on minimizing the distractions, where the use of risk assessment and feedback ensure effectively deployment. This process has further integrated cybersecurity into hospital operations. Project table. This table provides a detailed breakdown of 7 phases and the key activities and expected deliverables. The 7 phases of this project table are: first one, assessment and planning; second one, cloud backup integration; third one, AI threat detection deployment; fourth one, zero trust architecture; fifth one, employee training and awareness; sixth one, testing and evaluation; seventh one, go live and continuous improvement. This slide, titled as Implementation Consideration of Success Factors. First point, the success of this proposed solution mainly depends upon the effective commitment of the leaders, along with workforce upskilling and transparent communication across the departments. Second point, it also focused on creating a cybersecurity aware culture. The overview of this slide is: with executing sponsorship, the proposed solution will ensure research allocations where the digital infrastructure, investment, and staff training are important. This slide, titled as Implementation Consideration Challenges. First point, the major challenge of this implementation of the new solutions are resistance to change and financial constraints within the organization. Second point, strong governance and proper implementation while adopting the mitigations of the risk assessment are important to reduce the challenge. The overview of this slide is: the healthcare staff has focused towards resisting AI oversight. Ethical handling of the patient data is important for the responsible implementations. This is final topic of the presentation, titled as Conclusion. First point, from this presentation, it has been found that ransomware is one of the major cybersecurity threats that has been faced by the healthcare operations. Second point, a cloud integrated cybersecurity framework that enhances resilience. With the implementation of this solution, it would provide the healthcare organization a proactive approach for protecting and continuous learning. With proactive leadership, supports, and training, the healthcare organization can safeguard the patient well, maintaining operation stability. This is final slide, titled as Reference List. It provides the academic and industry sources that supports that facts, statistics, and proposed solution presented throughout this presentation.